Imagine this. Your newborn baby just entered the world. They have big, beautiful, innocent eyes. They look at you and trust you with their every need, with eyes that say, "I know you're my loving caretaker." You promise them the world and cuddle them once, taking in a deep whiff of their new baby smell. That very moment, you are interrupted and asked if you want to circumcise your new baby boy. In 2010, 58.3% of newborn males in the United States were circumcised. Many people circumcise their children because they believe that they should look like daddy, or that it lowers the risk of STDs, it lowers the risk of infections, or that it's easier to take care of. All of these are myths. Dr. Sears, a pediatrician known for his delayed vaccination schedule, says this about each of these things. As far as cleanliness, although this is true, a circumcised penis does not collect any white stuff underneath the foreskin like an intact penis does. It's not a medical benefit. All this does is create one less area to wash when you're in the shower. As far as the decreased risk of STDs, it doesn't make a difference. A circumcised penis is just as much at risk as an uncircumcised penis for the contraction of STDs. Decreased risk of penile cancer. It was once thought that uncircumcised men had a higher chance of cancer of the penis. We now know this benefit is much smaller than previously thought. The American Academy of Pediatrics determined this benefit is so tiny it's not worth circumcising for this reason. And avoiding infections. It's true that occasionally intact foreskins get irritated. This is easily treated with warm soaks and washing. Rarely it becomes an infection that requires a round of antibiotics. And it's easily treatable. Even if this does happen once or twice in a person's life, it's not a reason to circumcise them at birth. Avoiding the need to do it later on. Very rarely, someone has a problem with recurrent infections in the foreskin. They need antibiotic treatment. Some of these men have the need to be circumcised in an operating room, at which time they will receive general anesthesia and painkillers following the procedure. A newborn baby gets neither of these. These reasons are extremely rare and should be used on a case-by-case basis. Avoiding bladder infections. It used to be thought that circumcised boys and men had a much lower chance of bladder infections. The American Academy of Pediatrics now knows that this benefit is very small and is only true for the first few years of life. After that, there's no difference in the number of bladder infections between circumcised and uncircumcised males. Again, this is not a reason to circumcise your baby. In some cases, circumcision is necessary, such as the fusion of the foreskin to itself. However, these are fairly rare and as such should not be a reason for routine infant circumcision. The American Academy of Pediatrics study, it was found that the health benefits of newborn male circumcision outweigh the risks, but the benefits are not great enough to recommend universal newborn circumcision. So, I encourage you to do your own research and decide for yourself whether or not circumcision is right for you. And really explore why you want to circumcise your children before going through the procedure that will not likely be medically necessary, but really just a painful cosmetic procedure. I chose to leave my son intact. It's his body and his choice.